Hi everyone, my name is Dr. Robin Pashby. I'm a clinical health psychologist, the owner and director of Health Psychology Partners, a group psychology practice located in Washington, D.C. Our team regularly works with people living with cancer or dealing with cancer treatment. And I've been honored to be part of the Hope Connections educational program, and I wanted to record this video for those who might have been unable to attend the live event. When people think about cancer, they most commonly think about hair loss or some of the other side effects of treatments for cancer, because these are the things that are so easily seen from the outside and certainly affect the way you view yourself and the way others view you. But today's goal is to help expand your idea of body image to include not just how you look, but how you feel on the inside and how the world around you perceives you, so that you understand some of the aspects of body image that you may not have considered before during your cancer journey. There are so many aspects to dealing with body image. And when we think outside of the world of cancer and cancer treatment, usually people think about body image as something related to the shape of your body or the size clothes you wear or your fashion. And I think that that is a very narrow view of body image, particularly when we start applying it across issues related to cancer. Now, of course, cancer and cancer treatments can affect how your body looks and the shape and size of it. People gain weight or lose weight or have other body changes that can really affect how they feel about themselves. But these body image issues are so much more vast than simply what you see in the mirror. We know that when people have changes in how they feel about themselves, their sense of identity in the world, that it affects their relationships, it affects how others see them. And certainly with some types of cancers and cancer treatments, various aspects of intimacy and sexuality can also be affected. So if you saw yourself as someone who had a high libido or was very sexy and attractive, and suddenly cancer or cancer treatment has taken some of that away or changed the shape of your body or changed your drive or your interest in having intimacy with others, that affects your relationships and it also changes your identity. Those are pieces of your body image. Other issues related to fatigue, for example, from treatments or from, so many doctor's appointments and visits to the hospital and so forth, can really affect your energy level too. And if you have lower energy, it's so much harder to go out in the world and engage with family and friends, and that can also change your identity. If you saw yourself as someone who was social and outgoing, but now you find yourself needing more rest and you're very tired a lot, that can make you feel older or sickly or things like that that can really affect how you see yourself in the world. So my goal is to help you expand your idea of what body image actually means, because body image is actually a much more complex construct than simply what you see in the mirror. Instead includes your perceptions about yourself, the thoughts you might have about yourself, as well as the feelings and behaviors that you have in the world. But it's not just related to appearance, it's related to your entire body and its level of functioning. Some examples of body image changes that can be a consequence of cancer or treatment include, excuse me, alterations in your appearance. So for example, we mentioned hair loss, but also scarring or swelling, a lot of skin changes, redness or pockmarks or acne or other types of changes that appear on the outside. But also sensory changes, pain, numbness. These are types of changes that can really affect how you move about the world. So for example, let's say you have a lot of pain and numbness in your lower legs and feet, and it causes you to need to use mobility assistance like a cane or a walker. These assistance devices, while can be so helpful and important in you improving your quality of life, can really affect how you see yourself and of course how others see you. Functional impairments, difficulty swallowing or speaking, different difficulty with libido or sex drive or impotence for men, inability to climax, or other various issues that are often not spoken about but are really important in how you see yourself in the world. These are all part of your body image, and I think they all deserve some attention and awareness because there are some things you can do to help manage them. So, in terms of how do we deal with these issues that are so far ranging beyond just what you see in the mirror, first is cognitive behavioral therapy. And finding a therapist that has expertise in oncology would really help because a cognitive behavioral therapy approach helps you understand how the thoughts that you have about yourself affect how you feel and how those thoughts and feelings ultimately affect what you do. And then the loop continues because, of course, what you do further affects your thoughts and feelings. So let me give you a brief example. If you're someone that is dealing with a lot of fatigue as a side effect of cancer treatment, and you have thoughts like, I'm just so lazy, that makes you feel pretty darn badly about yourself, especially if you used to see yourself as someone vibrant and energized. Having those feelings of or thoughts about being lazy makes you feel maybe sad, disappointed, or lethargic, maybe depressed and anxious. And then, of course, if you're feeling depressed and anxious and lethargic on top of it, you're maybe likely to withdraw or isolate yourself or say no to an invitation out with a friend. And then the less social interaction you get, those behaviors start to change. Then you start thinking of yourself even more lazy. I'm not myself anymore. Those sorts of thoughts. So you can see how that loop can be self-perpetuating. So we work with people using a cognitive behavioral therapy model to really challenge some of that self-talk that might be getting in the way. But there's other types of treatments too. So if you're having problems in your relationship related to cancer or its treatment, going through work with couples therapy, particularly with someone who has a lens around oncology or health psychology, can be really beneficial. The same with psychosexual therapy, because there's so many more ways to have intimacy than simply sexual intercourse. And yet, those are often undervalued in our society. And so we have to really work at exposing and understanding these different types of ways of improving our intimacy. We certainly can all benefit from dealing with more mindfulness, which means being more present in the moment with less judgment of our current experience. And then body appreciation. And I'm going to go through some examples next of how body appreciation can be used with cancer and cancer treatment. But I want to say this with a caveat. I don't expect any of these interventions to have an immediate relief and you will feel like $1,000,000 when you leave. But what I do hope is that we can start to chip away at some of the body image negativity that has maybe crept in as you've dealt with cancer and its treatment, so that you start to have improved quality of life and better sense of self. So here are some examples of how a body appreciation lens can be used when you're dealing with cancer or its treatment. When you think about your internal processes, maybe you're really struggling and you have all of these, scars and skin changes and hair loss and weight changes and other things. And maybe it's really hard to find something that you appreciate about your body. Maybe try something like, my heart is functioning and can pump blood to my body. We can find gratitude even in the things that we maybe take for granted or don't always think about. If you're not having issues with your breathing, for example, you could say something like, my lungs can take in deep, fresh air, and that is something I am grateful for. When we think about our physical capacities, certainly these vary from day to day, maybe even hour to hour. But if you have a body that can maybe walk your dog or go for a walk with a loved one or a friend, you could say, my body can walk my dog. Or on harder days, even if all you can do is rest in a chair or in a bed, remember that your body can still hug or be hugged by a loved one. Bodily sensations and changes. For example, my body can see beautiful things in nature, or my body can smell the smell of morning coffee or freshly baked bread. Creative endeavors, for those of you that have a creative side, maybe something like, my body can still imagine amazing stories. And if you have the energy, maybe you can share some of those with someone that you love. For communication, for example, my body can still communicate using body language. And we know how important communication is to getting and giving the love that you want. And finally, self care. On days when all you can do is rest, remember that your body can do that. And it's okay to be grateful for the fact that your body can rest quietly when you feel tired. These are just some examples of a body appreciation lens that might help during some of the darker times when you're dealing with the changes that come related to your body image, how it functions in the world, and how others and yourself perceive you. So, what I hope I've done is give you a sense that when we appreciate our body's functionality at every level, we actually invite a broader conceptualization of body image. And that can help explain things like maybe why you haven't really wanted to go out as much or why you've been withdrawing from friends or family. If you're having struggles with how you see yourself in the world or how your body's functioning and how it's making you think about yourself, then remember to try some of these body appreciation approaches to see if we can't reduce that even just a little bit. Because I will remind you, even though I hope you already know, that bodies of all sizes, all shapes, and all abilities are worthy of respect, and that includes yours. Thank you so much for your time today, and I wish you well.